Okay. Good morning, colleagues. I hope you can all hear me.
Yes, we can.
Hello, good morning, everyone.
Good morning.
Okay, thank you so much. Thank you. Good morning, colleagues, and welcome to this meeting. This first morning. Good morning, colleagues from all over. Good morning, and thank you for joining us for this first series of webinar that is being organized by the West Africa Civil Society Institute. My name is Omolara Balogo, and I work with WACSI as the heads of policy influencing and advocacy unit. It's my pleasure to moderate this webinar today. And it's exactly 10 o'clock. We have quite a number of people that will be joining us for this webinar. So if you permit me, I would like to crave your indulgence that will give additional 3 to 4 minutes to enable our colleagues to join the webinar before we start the conversation. Thanks to all of you who have joined right on time. I think it's important that we appreciate your promptness. So we'll give another 3 to 4 minutes. Exactly 10:05, we'll start the webinar. We just want to give like 5, grace minutes for colleagues to join us for this conversation. So please kindly exercise some patience whilst we reach out to colleagues and also expect some of them to join us by themselves. Thank you. Okay, colleagues, good morning once again. It's exactly 10:05, and in order for us to keep to time, I would like us to start now to welcome other colleagues to join us along the way. So once again, my name is Omolara Balogun, and I work for the West Africa Civil Society Institute as the heads of policy influencing and advocacy unit. I welcome you all across West Africa, across the continent and the globe for joining us for this premier webinar series on COVID-19 and civil society in West Africa. The theme that we'll be looking at in this first series is assessing impact, responses, and opportunities for post-pandemic recovery for civil society in West Africa. I think it's important I say make a few remarks on what this platform it's all about. This is a regional platform that has been created by WACPODIS for civil society and other stakeholders in the region to continuously discuss how they are interacting or how they have been impacted by this global pandemic. It's where we're going to be sharing our stories, we're going to be deliberating, and also making call demand policymakers and regional ECOWAS, and we'll engage it on a monthly basis for as long as we have this pandemic among us. So this platform will hold next month and months to come on different topics. We're going to be looking at how our civil society to the pandemic. We're going to be looking at the different areas, different thematic areas that civil society are working on within the pandemic. We're going to be looking at the social, political, socio-economic implications. We are going to look at the gender implications. We are going to look at implication on civic space, on our programs, on resourcing, and so on and so forth. So please, if you permit me, maybe a bit of house rules. Please, let's mute our mics, though we have somebody within our team who is stationed who is on standby to mute our mics as we continue into the webinar. If you have any comments before we begin the question and answer section, please try to drop it on the chat section. Somebody is monitoring that. This conversation is going to be all in English, and it's important that we apologize to our colleagues in the Francophone and the Lusophone countries. Subsequently, we're working towards making it trilingual or bilingual at the least as we move on. Let me welcome our speakers for today. I know we have 15 countries in ECOWAS, West Africa, and WACPODIS as an organization works in 18 countries. That is the 15 ECOWAS countries plus Cameroon, Mauritania, and Chad. But because of our time, we know it's going to be difficult to have to keep, colleagues on seat for 3-4 hours. This is why we have tried to constrain ourselves to a 2 hours engagement. And we thought we would, shovel the countries as we move on into different thematic areas. Nonetheless, we have tried to invite colleagues from other countries in West Africa who will want to share their own experiences as well, be it as part of comments or as questions. But today we're focusing on 3 countries, Ghana, Togo, and Nigeria. Subsequently, other countries will be featured on other teams as we move on in this webinar series. So today we have 3 of our vibrant colleagues who will be speaking to us on the impact of COVID, the responses that has been taken at their respective countries by civil society, and the opportunity they are looking at for a post-pandemic recovery. And I'm going to just, read a little bit of their interesting profile. We have Beauty Emefanate, who is the current Executive Secretary of Ghana Anti-Corruption Coalition. Beauty Beauty has worked with the coordinated a World Bank funded project, including the West Africa Contract Monitoring Network in Ghana, Nigeria, and Sierra Leone. She's highly experienced in mobilizing citizen support through increased awareness and continued sensitization of citizens on the basic anti-corruption laws, especially the Whistleblower Act of 2006 in Ghana. She holds a master's degree in international affairs with concentration in communications and development, and a certificate in women's studies from Ohio University, United States. Welcome so much for joining the webinar today. We also have our colleagues from Nigeria. Oyebisi Babatunde Olusheyi is the current executive director for the Nigerian Network of NGOs. She serves as the secretary to the board. Oyebisi worked, before joining the NNNGO, she worked at UNICEF in New York as the global coordinator for the UNICEF Rural Voices of Youth project, where it provided linkages between rural youth and the UNICEF programs in 40 countries all over the world. And we also have our colleague from Togo, Antoinette Mbru. Antoinette is an international consultant. She's a human rights activist. She focuses on elections observation, mediation, and negotiation. She's also the first chair of the WANEP, West African Network for Peace Building, and she's also a member of the Truth and Reconciliation Commission in Togo. She's a lawyer, and she majored in public law. So these are the three colleagues that we have today that will be sharing experiences with us on how civil society in these three countries, Ghana, Nigeria, and Togo, have been responding, have been impacted, and have been responding to this global pandemic. It's important for me to say that as of today, the COVID-19 coronavirus is no longer a news. It's all over the world, and it has moved beyond being a health crisis to every one of us across different sectors, both, including the public spaces, the civil society sector, even in the private sector. It has moved beyond being a health crisis. It has touched the different parts of our lives. It has affected so many of us, negatively, and we have come to begin to see how we can respond to it, how we can live through these challenges and come out stronger. The challenges has been cross-cutting. For this forum, for this webinar, we'll be looking at, taking updates from these countries. We will be discussing some of the best strategies that civil society as a collective have adopted, to respond to this crisis. And we'll also listen to colleagues to share with us how they have been collaborating with their government if such, opportunity exists. Because from the few research that we have done, it has not been a common practice having government and civil society really coordinating. Most engagement has been led, has been state-centered, so to say. And also we'll be talking about some of the post-pandemic recovery opportunities that are there for civil society. Need I restate that we are not only affected as a sector. Everything that we do, our programs, our interventions, the community in which we work have been drastically affected by this pandemic. When this pandemic showed up in I think the first country to record a case was Nigeria in West Africa on February 27th, and it has been on the increase since then. As of today, from the last record that we gathered yesterday, we have over 24,000 cases of coronavirus in West Africa. We have recorded over 500 deaths and a little over 9,000 have recovered from this crisis, and the number is growing, though compared to other regions of the continent and of course in the world, our fatality rate is quite low. Notwithstanding, the cases are growing, and our government are trying to tackle this menace. I don't want to belabor the impact on our socioeconomic status as West Africa, as you know, in different countries, and some of the measures that our government has taken, I mean, globally, and some of the directive from the WHO has further exacerbated the challenges that not only civil society, but all development stakeholders have been trying to respond to. Issues around, social engagement, political participation, issues around gender equality, human rights. These are issues that, you know, we have been responding to before COVID crashed into, you know, our way of life. These issues have not disappeared despite the COVID situation. If I'm correct, it has even worsened in some cases. The impact on our socioeconomic status, the resources, the little resources that we have as governments, as civil society, has been redirected to respond, you know, to this COVID situation. And some of the tactics, you know, that some of the strategies that we have adopted to, you know, flatten the curve, as we say, to reduce the spread of this COVID has further affected our way of life as Africans. For example, the concept of social distancing has, you know, increased, has widened the gap within our respective, you know, communities. It has, and in some cases, and in most cases actually, very few of our people can afford the luxury of social distancing or self-isolation and others. We've had our schools closed. Very few children can continue their schools online. You know, we have people who do not have access to these technological, you know, tools or even knowledge to continue their education. Invariably, we have a chunk of our people who have been left behind, and this is definitely against the spirit of the sustainable, development goals. The impact on both formal and informal sector cannot be overstated. We've had people living who were struggling to cope with poverty, even being plunged back into poverty with the different economic crisis that we have. This virus has brought to us. We have almost zero social protections in most of our countries. This is something that civil society have tried to, and the development stakeholders have tried to push forward before the COVID came. But now with COVID, it's almost a total breakdown. There's increase in, sense of injustice, increase in violence incidences, inequality gap is being widened. We have reduced access even to health services, especially for pre-existing conditions. The fact that we have COVID now does not mean that other health crises that we were battling before are suddenly disappeared. They are still there, and it's difficult to address them at a time like this, that government is strictly focusing, most of the resources that we have on tackling the causes, the COVID pandemic. What about the marginalized? We have people who have been marginalized and are further marginalized with this situation. People living with disability, the IDPs in countries where they exist, women, the aged, the LGBTI communities, children, and have been affected different ways. We've had a lot of, reports on job losses, both in civil society sector and even others in private sector. The threat to civic space cannot be also, over mentioned. So, these are some of the issues that we have been talking about before COVID came. And if you look at some of our countries that are also planning to hold elections, if not for COVID, there would have been an increased engagement on political participation. There would have been constant engagement between the citizens, government, political parties, and all of that. But the concept of social distancing and the need to flatten the curve has not given us that luxury. These are some of the issues that we are dealing with COVID has tested not only our health sector and its decadency, it has tested our resilience as a people and, of course, our sector as civil society. So it's important that we have a platform like this where we can share and learn. So I'm going to, stop here just so we have more people join this conversation. And if you permit me, I would like to invite our colleague to share with us. So if I would like to invite Oyebisi from Nigeria to share with us what is happening, how are civil society responding to COVID in Nigeria, what responses, what strategies have we adopted, and what are the challenges that we are facing in Nigeria as a country. Oyebisi, you have the floor now, please.
Yes, thank you very much, Omolara. And just let me quickly test my mic. Can you hear me?
Yes, I can hear you. I hope colleagues can too.
Okay, excellent. So thanks for the opportunity to be here, and let me quickly give a scan of what the situation is at the moment in Nigeria. So at the moment, we've done about 38,000, over 36,000 tests, and we have 6,401 cases, about 1,734 discharged, and 192 deaths. And we all know that the response that we do have at this time in terms of reducing the spread of the virus has to do with lockdowns, curfews, school closures, interstate ban on interstate travels and gatherings. This time we have 2 states on total lockdown in Nigeria. We have 34 states on statewide curfew. We have 36 schools in 36 states of the Federation on full closure. There's no interstate travel, even though that is enforcement on that is very weak. 6 states across the country have provided a legal framework for all the activities, so they have a quarantine act in place. 33 states have their workers not working at the moment fully, and we have all the 36 states also having limitations or limits on gatherings. So when you look at all those responses, the federal government is also trying as much as possible to provide some fiscal policy and stimulus responses. We've had reduction in petrol. We've had a 15 billion intervention support. That was the initial intervention that was given. We've had another 500 billion crisis intervention fund. We've worked on our budget by revising it, and I think that will go to the National Assembly very soon. There are also monetary policies that we've heard from the Central Bank of Nigeria. We're seeing tax palliatives, and we're also seeing support to micro, small, and medium enterprises. There are also measures around palliatives at the customs and at our ports. We are seeing foreign aid and all of those bits. So why did I decide to mention all of this is to say that these are areas that civil society might want to focus their energies on in terms of monitoring to see how these measures and these palliatives are helping. Now, cascading it down to look to what is civil society doing at this time to support government in being able to ensure that citizens are able to cope and also respond to the pandemic. Civil society at this time is providing palliatives, even though that hasn't been acknowledged by government. They are raising awareness. They are also trying to work as much as possible around issues, rights-based issues, especially gender-based violence. So we've seen civil society providing telecenters, call centers for women or men that are abused to call. In terms of the impact on nonprofits, as Nigerian Network of NGOs, we've done, in fact, the research is still on, but the result we're having at the moment is that 57% of nonprofits in the country are saying that they've lost funds. 21% of them have claimed an increased cost to their operations. 64% are telling us that they've had to cancel or reduce their activities. 39% told us that the restriction in movement has affected their work. We're also seeing about 50% of them telling us they do not have reserve at all. They do not have reserves. 47% are also telling us that they might never in their life also thought about having the reserves. While 2.2 claim that they do have reserves, they are saying that that reserves can't take them around in a period like this, and they're asking us as Nigerian Network of NGOs to find way of providing funding for their work, and also ensuring that we provide technical trainings. For us, we are mapping some policy options away post-COVID, and these are areas that we also think that civil society should think of working on. When you look at vulnerability, we've not been able to address provide for the poorest of the poor. So we would need to focus on very strong social protection systems. So now I'm talking about the policy options. We also have to think about our food security as West African and as countries. We have to think about digital inclusion. Our lives have been on the internet all of this while. So we now have to start looking at internet affordability, accessibility, and meaningful connections. And meaningful connection is defined by the Alliance for Affordable Internet as when a user has access to a smartphone and 4G mobile internet, along with reliable fixed wired or wireless access at home, school, or work every day. So this is not the era of just having intermittent internet connection. This is the time for us to have meaningful connection both at home, at work, and at our schools. We need to also start looking at identity management, because the conversation has been, how do we give money? How do we ensure that the money gets to the target beneficiaries? We need to start thinking about this. Energy is another thing that we have to focus on. Energy, by this I mean electricity. Across West Africa, we do know the state of electricity, and now we need to really focus on that post-COVID. Water and sanitation and hygiene is also an area that we need to focus on and begin to hold governments accountable, and also work with them in ensuring that we're able to meet some of these elements that COVID has helped us to see as issues we need to prioritize. Livelihoods and decent jobs is another that we really need to pay attention to at this time. We've seen very huge private sector response, and we've seen very high level coordination on the part of the private sector. And these again leads to some elements or some lessons that we are teasing out as Nigerian Network of NGOs from the experience that we have at this time regarding the pandemic. We're seeing that platforms such as faith-based organizations are becoming important routes for engaging with government. So we've had churches having webinars and having governors, high-profile governors, coming to speak to constituents and to speak to the country about what they are doing in terms of responses. So churches are providing that platform, and I think we have to pay attention to that. We're also seeing more communication and collaboration at the heart of COVID-19. Now, when I then now say this collaboration, we can now distill it and say, where is collaboration happening? Collaboration is happening between government and private sector, not strong collaboration between government and civil society, but we're seeing private sector, civil society, especially non-profits, as institutions within civil society working together with the private sector in delivering palliatives. Philanthropic giving is on the increase, and also individual giving. We're witnessing that. We are also noting that governments or governors across the 36 states are exchanging notes amongst themselves. They are peer reviewing each other and learning best practices. And we are also witnessing the use of public opinion in decision making now. For example, Lagos and Ogun State did a poll asking citizens whether the lockdown should be relaxed or expanded. Now, these are some forms of participatory governance that we want to ensure that we encourage post-COVID. We're also seeing a test to our federal system. We've seen dissent by some governors, governor in Cross River, the governor of Port Harcourt, River State, and Kogi. We're seeing them dissenting and saying, just doing what they like, as it were, for a lack of a better word. We're seeing the use of big data in being able to look at who are the most left behind and how can government support the vulnerable. So now government is aggregating data from telecom subscribers to be able to know how do we get money to people, but they're having third-party issues and they are working around those third-party issues now. We've seen increase in fake news, disinformation, misinformation, and we are all privy to the 5G conspiracy theory. we've seen the use of mainstream media, social media, and other channels, but used by government and governors and even agencies in the front lines to disseminate information. Now we think that is one of the good part of information dissemination. Our Human Rights Commission is also now up to the task. They've been able to develop a guide on how to ensure citizens' rights or a patient's rights during a pandemic, and to ensure that those that are under treatment have their rights respected. Well, we've also seen a state in Nigeria, Ekiti State, using the media to distribute its palliatives. We thought this is a very good innovation. There's also a nutrition advisory being touted by a state in Nigeria. The other state government is saying we might start having to give out nutrition advisory to citizens so that they can use that to shore up or build up their immunity. So far, these is a snapshot of what we're seeing in Nigeria, and I'll hand over back to Omolara.
All right, thank you so much, Oyemisi. That was quite a lot in about 10 minutes. Thank you for sharing this happenings, this update from Nigeria with colleagues from all over West Africa who have joined us today. Please, colleagues, if you have questions, kindly put it, use the chat button so that colleagues who are on standby can note it, and as soon as we open the question and answer section, we can take your questions up, or if you have something you want to share from your own country's, perspective. So I'm going to move on to Antoinette. Antoinette, what is happening in Togo? What is happening in Togo with regards to COVID and civil society? How have we been coping? What has been the strategies, the response strategies? Antoinette, you have the floor now. Antoinette, if you're speaking, your mic may be on mute. Can you check?
Are we okay now?
Yes, perfect. We can hear you now. Wow, good to see you.
Bonjour from Togo. So like I was saying, it's a big privilege to be on board with you this morning. Thank you very much for this opportunity. Thank you for my colleague that just highlight some things that are happening in Nigeria. Is almost the same thing that is happening in Togo. Right now in Togo, as yesterday, we recorded some cases, active cases, we call it here in Togo. About 219 people have coronavirus, and we recorded 107 people that are healed and 12 people that are dead. That's the health situation actually. The impact, I want to focus on the impact of this situation on Togo, on my country right now. I want to bring to your remembrance that in March, when this situation started in this country, the government has been given the rights to take ordinances to fight against the COVID-19. It is a main point we have to underline, because it is going to affect the women's rights in our country. Another thing that we have noticed among the measures that were taken to fight against this pandemic was some legal regulation that have been put down by the government. Among those measures was the curfew. And that curfew has been a situation where women's rights in the country has been so much challenged. We even witnessed someone, or I don't think people that were dead because of this curfew and the way it was handled in my country. Right to integrity, right to life that have been violated in this country. And you talk about the economic impacts, and you talk also about the health impacts. it has been the similar situation in my country. I want to move to the responses that the government and civil society actors have provided to fight against this issue. The first response that have been provided to fight against this situation was that a hospital has been reserved to treat the coronavirus sick people. Is among the measures that has been taken. And another one has been that places has been reserved to confine people that have been detected with the sickness. What is wonderful about what is happening in Togo is that we have not witnessed so many cases of coronavirus people, sick people, I mean. There are some barrier measure and co. Now, talking about what civil society organizations have done so far, it is amazing to notice that civil society actors have not done much in Togo. What has been particularly been done is that we have been, or some civil society activists have been arrested because they were discussing the governmental measure put down to handle this situation, violation of human rights and co. So they have been writing some declarations to bring to light the violations that have been going on in the country. But it's amazing that civil society organizations have not done much, apart from organizing themselves to put money together to give some help to population. Much has not been done. The question is, I believe personally that the civil society in Togo is I would say, is locked down too. That's the idea we are perceiving. That's what we are perceiving, like activities are locked down. So civil society in my country is locked down. What are we doing? Not much. You see? So, Lara, these are the concerns right now. But we believe that there are huge opportunities we can explore. This is the time to take advantage of the situation and do some action on the ground. Our life have been depend in these few months on internet. And like you have underlined it, that not many people have access to internet in our country. I think this is an opportunity for civil society to come out and do some actions so that many people can have access to internet. You understand? And another thing is we've not spoken so much in the sense that we can bring the government to have some action to do together with governments. I don't know if you understand. Lara, it will be easier for me to go in French, but I know most of our hearers are English people. You understand? Like we can do some action to show that the civil society in my country has a great role to play, because the decision that have been taken has not involved civil society organization at all in my country. You understand? These are the issues I want to point out. Another issue is the issue of health, the general health that we have in these few months. I think the measures that have been taken are just taken, and they are not based on some scientific or exactly some scientific research. For example, we lockdown population, we are asking them to put on masks. They are putting masks, and the impact of putting on masks has not been searched anywhere at all. ordinary science show us that if I put a mask, I block the CO2 that I'm bringing out. You understand? And I'm asked to put on the mask the whole day because when I go to the office, I have my colleague, I have to put on my mask. The effects, the impacts on health has not been shown to anybody if it is good for people or not. These are some vital health issues we have to work on as civil society organization. We have to organize some, like you are doing, webinars, some discussion on what's the impact of these measures that they are suggesting for population. Is it for our good? These are some issues we have to discuss. We have to bring the attention of the decision makers on the fact that some decisions are taken without some scientific proof. So in the years to come, I think today we are creating some other problem. From today, we are creating some other problem that are going to be generated tomorrow. So these are some points I want to bring out. But the amazing thing is that civil society and organizations are not doing much right now in my country. Thank you very much, Lara.
Lara, you're on mute.
I'm so sorry. Thank you so much, Nana. Antoinette, thank you so much for sharing those insights with us. And again, I was thanking you for speaking in English. And I was saying that I feel uncomfortable, having to put you through, that pressure of having to share your view in English. And I promise that we are working on getting that resolved as soon as possible. You have indeed shared some similar feedback like OABC did with us. Let's hear from Ghana what civil society as a sector has been doing, how we have responded to, don't forget I'm also a Ghanaian, how we have responded to COVID since it showed forth here, I think March 12th, and what has been the general situation, what has government been doing, and so on. So I'm going to invite Beauty, who is the Executive Director of Ghana Anti-Corruption Coalition, to share those insights with us. Beauty, you have the floor now.
Many thanks, Lara and Waxy, for the opportunity. Good morning, everyone. I would like to say that some of the issues raised or highlighted by the previous speakers also coordinates with, resonate with what Ghana is also facing. As Lara rightly said, the COVID case was first confirmed on the 12th of March 2020. We had 2 cases which were imported from Norway and Turkey. But as of today, which is approximately 10 weeks of the confirmation of the first cases, we have recorded 6,096 cases. Out of this total, we have 61% being male and 39% being female. We have also been able to record some significant recoveries. As at this morning, we have recorded 1,773 recoveries, which is very significant looking at the picture in Africa. We have also recorded 31 deaths, which is also commendable if you align it with other data from other countries. And I would like to point out that when it comes to COVID, Ghana seems to be in competition with Nigeria. In fact, I found it surprising and fascinating that we started running head to shoulder for some time. As at yesterday, we were ahead of Nigeria in terms of cases, and then by evening, the tide had changed. So just to say that Ghana and Nigeria do not only compete in football and jollof rice, but it seems we are also competing in COVID. I would like to also point out that this year is an election year for Ghana. So amidst all this COVID, we are also preparing for our elections in December, similar to 5 other West African countries. I would like to highlight some few impacts of COVID in a few sectors, just to draw or paint the picture of what the Ghana situation is. In relation to employment, there has been increased job loss, particularly in the private and informal sectors, as against the public sector, where jobs are a little bit secure. Several private businesses, mostly the SMEs, in a bid to mitigate the effects of the COVID, downsize or close completely, and the daily income streams of many Ghanaians were affected. We observe that children are now on the streets selling to support their families, whilst their parents struggle to secure jobs and income. The job income loss has also motivated some businesses to shift to new opportunities to fill the COVID void. For instance, some alcoholic beverages producers have shifted to the temporary production of hand sanitizers. Some have also started producing hand sanitizers at home, while some seamstresses and tailors have also joined the business of producing local-made nose masks with local fabrics. With the health sector, we have witnessed a shift in focus from the management of primary health care, such as malaria, TB, HIV/AIDS, antenatal, and all that, to the treatment of COVID. For instance, recently we documented an outbreak of CSM in the northern part of Ghana, which recorded over 40 deaths, but it had little media visibility compared to the 31 deaths recorded by COVID within the same period. Positively, in the health sector, COVID has also, in a way, supported in strengthening and expanding the existing healthcare facilities in the country. Perhaps one could attribute it to the closure of borders, which has compelled the political elites to seek medical care locally instead of going abroad, as has been the practice. Aside that, we have also witnessed the supply of PPEs to health facilities by governments. We have also seen some inequity shifting in the siting of health facilities, and then deployment of staff, and then also expansion of laboratories and testing centers nationwide. With regards to education, the closure of schools, both basic, tertiary, public, and private schools, created the need for innovative measures to keep students engaged at home. Thus, remote teaching learning was implemented initially by the private schools, and later this was followed by the Ministry of Education and the Ghana Education Service, which also rolled out some distance learning platforms targeted at all levels of all level of students there, including the tertiary. This notwithstanding, we actually witnessed challenges such as limited internet access, high cost of data, even though government had engaged the telecos to reduce cost of data. We have also witness limited access to personal computers or smartphones by students to access these learning platforms, as well as poor TV and radio signal in some cases, difficulty with access to electricity. We have also witnessed incomes to private schools being badly affected, and about 94,000 private school teachers have been left with no income. A major debate this week has been how to strategize and reopen schools. And yesterday, I tuned into a discussion where the public school teachers are opposing the opening of schools, while their private school counterparts think otherwise. And I heard the private school teachers making a case for themselves by accusing the public school teachers of complacency because their salaries were assured, when they in the private sector are not getting salaries. Even though the public sector teachers were also making a strong case that until social distance and safety protocol measures are put in place in all schools, they do not think that it is safe to reopen schools. And the debate has continued, bringing in some PTAs to also take positions based on what perspective they hold. We've also seen that the disruption in the sources of income and job losses and the restriction in movement and the closure of schools has increased worry and in some instances resulted in tension within families. This situation has increased incidents of domestic abuse. A UN Ghana report projected a high tendency of increased domestic violence during the lockdown. And this was situated in the background of a previous research that revealed that about 38.7% of married Ghanaian women between the age of 15 and 49 had experienced physical, emotional, or sexual violence by a husband or a partner at some point in their lives. Added to all this is the grappling issue of stigmatization. Community acceptance of recovered persons has been problematic. Sometimes the stigmatization is extended to the close families, friends, co-workers, among others. Such people are faced with physical, emotional, and psychological isolation from the entire community. Recently, the media highlighted a case of a child whose parents had just recovered from COVID being stoned by other children in the community because of the situation her parents suffered. This is just one among such abuses that has been recorded. Government, similar to the other speakers, have put in a lot of measures to mitigate this impact. Some of them including enforcement of social distancing and safety and preventive protocols, particularly restriction on all public gatherings except burials, private burials of up to a maximum of 25 persons. And then there is also the mass disinfection of markets, senior high schools, police stations, where we've gotten some recorded cases. Government has also enforced wearing of nose masks in public places. There is also some coordinated communication and community outreaches by government with the use of sign languages, and then the COVID response team, as well as the increasing in the testing and isolation and treatment centers. Aside this, government has also offered some utility support to citizens. For instance, we have like free water and electricity for 3 months, depending on some certain thresholds, but at least for 3 months, citizens don't have to worry about water and electricity. That is those who have access to these utilities. In addition to that, government has also made provision for some stimulus packages for SMEs and then to support the recovery of businesses, as well as some support to bigger businesses. So looking at the situation, one may wonder, does this present some opportunities for CSOs to engage in this process? As civil society, we were able to coordinate ourselves in terms of forming a CSO COVID-19 response, and as well as launching a CSO COVID-19 fund. In terms of the fund, we targeted 200,000 Ghana cedis, which is approximately $35,000. And I must commend the efforts of the executive director of WACPODIS, Nana Afajilo, who is the brainchild of this process in Ghana. And I think that we need to commend her efforts and the push to get civil society to work around the clock. So as part of that, we were able to launch the fund and then supported over 1,000 people who are affected by the lockdown. We donated food items, soap, medical supplies to widows, the aged, the mentally ill persons, people with disabilities, and the street children were not left out. Interestingly, most of the people that we targeted had not received any support from government or the private sector. The second phase of the fund is going to focus on public education and community sensitization at the local level. We expect to target the marginalized and vulnerable groups, as well as children, and then also provide stakeholders with nose masks to aid their movement and protection. This notwithstanding, we are also facing difficulty with accessing funds to mitigate the impact of COVID on our targets.
Beauty, you can just round up shortly. Yeah.
Okay. I should have explained that in terms of the COVID fund, these were donations from individual CSOs and other partners. So in all, we're able to put together a coordinated intervention that convened a response team to harmonize all our activities. And we are currently having CSOs work around COVID-19 accountability tracker to track all government revenue expenditures. We also have CSOs looking at fact-checking to address issues of fake news. We are also reaching out to the vulnerable groups, as well as addressing the issues of gender violence. In terms of the way forward, I would like to recommend a comprehensive policy response approach that benefits all structures at all levels. I must say that even though government did not give civil society the full recognition of our capacity to complement its efforts, we need to find new ways to occupy the civic space for the desired impact. We can no longer wait to be invited. We need to bring ourselves to the table. We also need to accept the reality that COVID has not only changed our life, it has also changed our operations. We also have opportunity to reap the benefits of decentralization. And finally, I would also want to commend WACPODIS for this initiative, and I believe that as we collaborate and peer learn and share, it will also enhance our strategies and approaches that we put together. Since COVID has given us opportunity to think out of the box and innovate in terms of addressing the challenges we face as CSOs, and then mobilize, support, utilize, and push our convening power to make us be heard by the policy actors. Thank you very much.
Thank you so much, Beauty. Thanks for sharing those insights with us, especially. I mean, I'm pretty much familiar, but of course, to the benefit of our colleagues who are joining from across the region and across the globe. Thanks to the three of you for sharing what the situations are on the ground in the respective countries. A few points I noted before I would like to go around the speakers the second time before I open the floor for it's just 11 o'clock now. Before I open the floor for comments and questions, we have two critical areas that we have not explored and would like to hear from the speakers. One is on the opportunities that are there for collaborations between civil society and government. One thing that cuts across statements from all the speakers is that this opportunity does not exist at the moment. And in some cases, at the ground, the environment is not even conducive for such opportunity to occur. In the case of Togo, as Antoinette really shared with us, she made a statement that really made me grin, that it's like civil society also went on lockdown, especially because the context, we know we have, in as much as we have similarities in our context, there are still specific differences, that differentiates, Ghana, Togo, Nigeria, the Gambia, and all of that. We have diverse issues we're dealing with in our respective countries. So I think I would like to explore that more. Now, three of you have mentioned that this opportunity doesn't exist now. And even where civil society have, made strides to respond, to assist, with the situation, there's been no recognition. I am aware that in some countries, my country, my country of birth, Nigeria, and now my adopted country, Ghana, I've not seen instances where government has invited civil society to be a part of its plans. There's been a lot of engagement within government itself, and also a few times with the private sector, because this is where the resources are coming for, even for government to respond. So we need to explore that a little bit more. And you also talked about the human rights violation, which is something I started with when this conversation began. Three of you talk about the enactment of various laws, bills from government, directive from president, and so on, just to ensure that some of the responses that government were putting in place were being adhered to. In these cases, in these instances, we have had or recorded series of human rights violations, disruption to, freedom of association and assembly, and so on and so forth. And this cuts across the three countries, especially in Togo, as Antoinette has really shared with us. Antoinette also mentioned something that I personally do align with, that most of the mechanisms that our government adopted were not contextualized. I remember when one of the presidents in West Africa, I think the first day they recorded our case, the first thing was social distancing. And I was asking myself and my colleagues, what does that even mean in highly, densely populated area in Lagos, like Oshodi? What does social distancing mean? Are these guys really thinking about the context before borrowing or adopting strategies that would work very well in a city like London, France, or Paris and all of that? Oyebisi mentioned that philanthropy giving is on the increase, and I do acknowledge that across the countries. Maybe I didn't hear much of that from Togo, except for individual giving, which is also philanthropy. This is on the increase, and this is something that civil society has strived through over the years. not only from private sector, from individual philanthropics giving to help the most vulnerable in the society. So these are some of the critical points that you have raised. But I would like to come back to you, since we still have, a fair time to engage on there. Currently, we do not have opportunity to engage with our government. Nonetheless, we are contributing our quota into addressing these issues because we are closer or closest to the population, to the communities in which we work, especially our colleagues who are working within the community, the CBOs, those who offer direct services to, the aged, the marginalized within the communities and all of that. How can we is something that we have struggled through over the year, not only to be recognized, but for us to be seen as a complementer of government's, intervention or government's role in development. How can we, at this point, it is no longer luxurious for us to stay in our lane and not engage government. We need to engage as we move on, because it's a fact that this thing is probably going to be with us for, a longer while. And we have to continue living. We have to continue engaging. What are the opportunities? What would you say in your respective countries that civil society should take, to ensure that they engage with government? Maybe we have waited for so long for government to engage us, to recognize us, and the role that will play in development process of these countries, but it's not coming. What window, no matter how little, is there that we can engage in? And secondly, is the issue of post-pandemic recovery. All of you already made mention of one or two strategies that we can use, but I was reading a report, I guess it was my ED that shared that report with the team. It's by an organization called Link Report, and it talked a lot about how civil society sector has been affected by the pandemic. A few notes I made, just so you in your response, you can give some insight on how you think civil society in your countries can respond to these issues or seize opportunities. It says about 13% of civil society have closed down as we speak. 13%, 13. They've closed down because they just couldn't cope with it. They don't have, and you see that most of them do not have maybe technological facilities, tools, or skills to even do what we're doing now, to engage or continue their work, virtually. And most importantly, for organizations, for our colleagues working within the human rights spaces, social justice spaces at the very local communities, there is no way they can do all those things, all those interventions online. So we are actually among the privileged few. You also talk about other problems that this organization are responding haven't disappeared. So what opportunities do we have, or that we should think of, or we should explore post-pandemic? We don't know when this post-pandemic is going to start, because right now we are in pandemic. So I want us to talk about that briefly. And then lastly, I think we'll probably give like four minutes to each person, or 5 minutes to each person. And lastly is, I have been following development across the region, being the fact that we're a regional organization, and I have been on platforms where the AU mechanisms, have been largely discussed. I know the last meeting that the African Union had, they came up with what they called, I think I put it down somewhere, the AU response mechanism, where they talked about having the countries having to share data, work in solidarity, communication, and all of that. So that brings me home, and I know the African Development Bank is also putting, some resources together to respond to COVID and also to support civil society. We haven't really seen the light of that as of now, but of course the conversation started a couple of weeks ago. So that brings me home to echo ECOWAS. I know ECOWAS through its WAHO, the West African Health Organization, a health agency, have responded by providing some materials to governments, especially the frontline workers. But ECOWAS as an institution, I would like you, I know it's part of the things that you have prepared for. How can we engage with ECOWAS? Just like our various governments, we have given a lot of time for governments to engage us, but that seems not to be coming. So in your response to how civil society in your countries should engage with their government, let's also talk about how we can engage with ECOWAS as, as a collective, as civil society in West Africa. I think I'm aware that there was an extraordinary section of the head of state where they discussed the pandemic and the elected president of Nigeria, Buhari, to be the champion of their intentions. But up until now, we have not had any critical, cogent actions being taken by the ECOWAS, and we have not even seen a plan of actions that ECOWAS has. So I think it's time that we'll knock the doors that we think we can work with our government and ECOWAS. So I'm going to start with Oyebisi in 3 to 5 minutes. What would you say we should do as civil society for all these different highlighted areas? Oyebisi, you have the floor.
Well, thank you again, Omolara. You've eaten into my 3, 4, 5 minutes already, but you've seemed to elect everything by that synopsis that you've given. I think as civil society, we need to advocate differently, meaning that we need to follow what government is doing with an open mind and work on the trust deficit that we have, then look for opportunities to engage better. So one opportunity that I'm seeing is the Lagos state government is calling for volunteers. How are we supporting them with good best practices on how to manage volunteers, like sharing with them a guide? I'm seeing the lack of engagement between government and civil society. So myself and my colleagues are now working on an engagement strategy for governors to engage with civil society. So we need to look at those window of opportunities within our own strength and then begin to engage such processes. Yes, it will take a while for government to also trust our sector, because usually they've seen us as the opposition. So how are we again advocating differently? And in my presentation, opened up the space as to areas where we need now to start talking. So the era of everybody working in HIV/AIDS or education is gone. We need to look at where are the strategic accelerating issues that can help us accelerate our development. We need social protection. We need to protect the vulnerable. Non-profits working in that space have a moment now to increase advocacy. 2, to also document learnings that we have elsewhere and begin to use that to retool national strategies on on social protection. So they would have to open up, send a letter, ask for a meeting with the minister. If it's not forthcoming, ask, find a way of, opening that door and, through policy briefs, letter writing and all of those bits. So we'll need to advocate differently. The era of antagonizing is gone. We've been saying this all this while. We now need to start organizing and organizing very well. There's a need to communicate with the population. When you look at all the information that are coming out, it has been in English. Can civil society with expertise and capacity begin to look at other languages, Yoruba, Hausa, Ibibio, and bring this communication out in those languages? I'm sure government would appreciate that, and that way we can continue to be valued. We need to be able to monitor and track resources, monitor our own resources that we spend. So for me, I'm saying to myself, what if, this morning, I was saying we will have to send out an email to all our members, asking them, how much have you spent on COVID-19 palliative? Can you tell us, so that we begin to use that also as negotiation to say, while we are in pandemic, this is how much our sector, because the only beauty of private sector is organized. They're able to tell you how much resources they bring into the economy. Yeah. We're not able to do that as a sector. So yesterday I was discussing with other young civil society leaders, and we're looking at coming up with the economic impact of non-profits, to the economy. But we'll start with these palliatives. How much have we spent as civil society, and begin to use that to engage differently. Another thing is to look at what has worked and what has not worked. So if you notice my presentation, I was able to tease out the things that I'm saying that are making sense to our work and to the advocacy that we've had all over the years, like citizens' participation, opinion polls, the use of the media to distribute palliatives. We need to be able to help government tease out these practices that they themselves have, utilized in addressing the pandemic and send it back to them as what they should continue to do post the pandemic. So the era of waiting has gone. We would have to find a way of engaging, but in also engaging, like our own advocacy strategy. Who is the messenger? All right, we need to find the right messenger. But again, within civil society, when the messenger emerges, we are the ones discrediting the messenger. So civil government itself will tell you, who do you want me to talk to? But again, those are issues that we need to pay attention to as civil society ourselves. Reiterating, advocate differently, communicate differently, engage differently, and monitor your own activities differently. Over to you, Omolara.
So you meet the point on ECOWAS. What are your thoughts? Because after this meeting, we hope to engage.
In all fairness to you, I've seen the African Union doing more than ECOWAS. And I'm not able as an African or a West African to place ECOWAS within my thinking at this moment. And I'll tell you why. African Union, immediately this issue started, we have 2 envoys. And what is the mandate of the envoys? To go negotiate for a debt relief or debt holiday. Now, what has ECOWAS done? I haven't read so much about ECOWAS intervention. All right, so it becomes very much difficult for me to say these are the ways we can engage. At that level, I know civil society has engaged with the envoys, and we're working with them on a lot of strands, as to how to help their work. There's a part where at the African Union level, African civil society must join the debate on a debt holiday or a debt relief for our country, so that monies that are meant to be used to pay those debts could be plowed back into our national development and we can see results. So, but for ECOWAS, honestly, to you, Omolara, maybe they should do more better.
All right, thank you, Oyebisi. Thank you so much. I'm going to go quickly to Antoinette. Antoinette, if you're speaking, your mic is on mute. Antoinette, your mic is okay. I think I have 2 Antoinette. So please go on, please. Hello. Whilst Antoinette is trying to sort a computer and internet out, let me take Beauty. Beauty, what would you say? How can we engage with the government of Ghana? How you talked about us not being the contribution we've made not being recognized at the moment, and of course the issue of ECOWAS. How do we proceed from here? Beauty, please, you have the floor.
Okay. Thank you very much. With regards to bringing us to the table, or we need to do business differently. We can no longer stay as national TSOs and be comfortable. We need to build a critical mass at the local level to support our legitimacy as mouthpiece of the people. Politicians look at numbers, and if we are able to mobilize that, I think that will be very, very critical to our engagement with government. A case I would like to share has to do with a recent advocacy effort that we embarked on, where we noted that the National Commission for Civic Education was not giving the needed attention in terms of support for public education. So Hello, can you hear me? Hello?
Yes, I can hear you now. I guess it was my own internet.
Oh, okay. I thought I was speaking only to myself.
No.
So I was talking about the example where we engage in a wider stakeholder advocacy. We were able to bring together about 60 CSOs, both at the national and sub-national level, to be able to advance and push for support for the National Commission for Civic Education. And this advocacy was immediately responded to by government, and government gave the needed support to NCC. This actually is a proof that when civil society, we take away competition. Hello?
Yeah, we can hear you.
Okay, so if competition is taken out and we build more trust and open up and collaborate in terms of our work, we are at an advantage in making more impact and then being brought to the table. In addition to that, I think that it's also important that we coordinate our activities, because given the limited resources, we can only harmonize efforts and resources by bringing together what we do so that we don't duplicate. And that is also a way of coping with the COVID, given the challenges civil society is facing with resource mobilization. Another issue I'd like to bring attention to is, how do we document our efforts in terms of our contribution to the GDP? We have not been successful at showing to government how we also contribute to the GDP. When government is looking at GDP, the first people to bring on board is always the private sector, because they can visualize the contribution of the private sector. But we are usually left at the background. So we need to look at how we document this in terms of this support. And I believe that institutions like WACPODIS could support in this direction, to be able to document CSO's contribution, as well as help in terms of monitoring our efforts better. In relation to ECOWAS, I think that it's also important in the same line to document our efforts regionally. We cannot only be seen as contributing in silos, but if we have still challenging WACPODIS, if WACPODIS that has a sub-regional tentacle can support in bringing together all the efforts that CSOs are doing in the sub-region, so that we can highlight this in terms of engaging ECOWAS. And I do agree that ECOWAS has not shown a lot of responsiveness when it comes to these issues. Perhaps if we engage them the more, perhaps if we bring in terms of documentation of the issues, that could also help in having them open up and be more supportive of our process.
Thank you so much. Thank you, Beauty. Thank you so much for that. Antoinette, you have 2 minutes. Are you there? Antoinette, because I really like to open the floor in another 5 minutes. We have quite a number of people. Antoinette, please. ECOWAS, and how can CSOs in Togo operate with Togo government? Antoinette. Okay, guys, I think colleagues are reaching out to Antoinette on her phone. So we're going to open the floor now. Thank you so much. Antoinette, are you there? Antoinette, we can't hear you if you're speaking, but I promise you, all the speakers, we have at least 1 more minute to round up, to give their last statement when we are rounding up. So just hold it.
Can you hear me now?
Okay, we can hear you now. Yes, please, Antoinette, go on.
Before I come to the ECOWAS point, I want.
Hello, Antoinette, you're on mute.
What do I mean?
Your mic is on mute, Antoinette. It's going on and off.
Hello.
Yes, please.
Are you here now?
Yes, we can hear you now. Hello, Antoinette. Your mic is on mute. Okay, Antoinette, I think I'm going to hold you till the end of the conversation where you have a chance to speak for another 2 minutes. I want to open the floor now. Quite a good comments have been made about how we can coordinate ourselves and engage with our government and ECOWAS. So let's open the floor. You can, if you like to speak, you signified by raising your hand. And then we can pick you. Just limit your contributions or questions to, if I can have it less than a minute, I think that's going to be fantastic. But otherwise, at least 1 minute so that we can take as many people as possible. So over to the house. Hello.
Omolara, I already sent a message.
May I know who is speaking, please?
I sent a message to the chat room. That's Rahim at ECOWAS.
Yes, good morning. Okay, I'm going to pick the message now. Okay, so Auntie Rahima, I mean, you have the floor now. You can just say it to everyone.
It's afternoon in Abuja. So I say good afternoon to everyone. I hope you can hear me.
Yes, please, we can hear you.
Yeah. My name is Rahimat Mamadou. I'm the head of Human Security and Civil Society at the ECOWAS Commission in Abuja. And I want to start by congratulating Wasi, Nana, and Omolara for this webinar. And I'm excited that it's going to be monthly, and that I suppose we're going to be taking three countries per webinar. And that we also, it's a good thing because it allows us to discuss each member state. First, in terms of engagement with ECOWAS, I don't know, I'm surprised that even Omolara and the three speakers said ECOWAS is not doing much, after Omolara has told us that the West African Health Network is doing a lot. And then in the same breath, you are saying, what is ECOWAS doing? The WAHO, the West African Health Organization, is the WHO of ECOWAS, so you cannot separate it from ECOWAS. Being that the pandemic is a health pandemic, our ECOWAS response is anchored by the West African Health Organization. So it's just like you separating WHO from UN, and you know, that is our specialized agency for health. So if whatever WAHO is doing is an ECOWAS response. Having said that, is the fact that I'm sure Malara is aware, Nana and I had spoken more than a month ago. We are planning a virtual meeting. I won't call it a webinar as such, maybe you call it a webinar, with civil society in the ECOWAS region to discuss precisely what we're talking about, engagement with ECOWAS. What do you see happening? How do we go forward? And that's why myself and my colleagues endeavor to be part of this webinar today, for us to begin to get insight. So by the grace of God, that meeting is still going to hold. Right now, yes, lockdown in Abuja has been eased, but you agree with me, for an organization like ECOWAS, there are a lot of things to be done, working on different fronts and other things. And of course, you also alluded to the extraordinary summit and the champion being the president of Nigeria. So very soon there's going to be additional response from ECOWAS in addition to what we're doing. So just to let you know that
okay. No, I think there was a break-in from someone. My colleagues are monitoring that. So please, Auntie Rahima, you can round up.
Yes, let me round up to say that, yes, I don't know how many of you will be able to get into that meeting, because as you know, we interface very well with the WACPODIS, which is our main interpreter, the West African Civil Society Forum, which I'm already in talks with, which Nana is aware. So we're hoping to have that meeting where we're going to discuss more concretely additional engagement spaces with ECOWAS and what ECOWAS can do as a regional body to support what the civil society see as opportunity to engage their national government in terms of responses now and post-COVID. Thank you very much for this opportunity.
Thank you so much. Thank you so much, Auntie Rahima, for that insight. And okay, I think you and I will speak. We'll speak afterwards. So if I can I see other ends? Auntie Rahima has shared with us ECOWAS has plans in place and will be on uncovering the plans very soon. And indeed, I acknowledge that we've had bilateral conversation with our office on some of these issues in recent past. So we'll definitely be reaching out to colleagues on this platform as soon as we are ready to take off with that. So yes, everybody's going to participate, I can assure you, Auntie Rahima. I'm not seeing any other hands or question in the house, or I hope I'm looking at the right house. Okay, I think Matthew says that there are a few entry points that could be explored. WACSOV is a platform we cannot leverage necessarily. I'm not sure the point there. So Matthew, if you are there, you can take the floor to explain that question. Okay, there was a question to Oyebisi. Oyebisi, there's a question on what Nigerian civil society is doing, how the CSOs in Nigeria are responding to gender-based violence. Yeah, even though we hope to. Yes, Oyebisi, have you seen the question?
Hello? Omolara, I've not seen it, but if you can help frame it, that will be better for me. Then
okay, so the question is about, the question says, how are CSOs in Nigeria responding to gender-based violence, I believe within the COVID era, and that do you think that Nigerian government's response has been gender sensitive in any way? How are CSO responding to gender-based violence? And do you think the government's response has been gender sensitive in any way? So you can respond to that very quickly before I take the next one.
Okay, so before I go to that, let me also quickly respond to the ECOWAS issue. Is to say that while we're not saying ECOWAS hasn't done anything at all, we do know they would have done something. I think communication is lacking. So all of the things I've mentioned here today, I just sat in front of my computer to monitor what government is doing, to monitor what African Union is doing. On the part of ECOWAS, I've not seen that communication coming out strongly. So maybe ECOWAS wants to pay attention to that. We do know that there's an health-based platform that deals with WHO and all of. We know that. But what is ECOWAS doing in terms of economic stimulus and all of those bits? That's our concerns as some of us as civil society. Now, in terms of gender responsiveness of some of all these palliatives and measures, it's weak. It's not there. Nobody has paid attention to gender dynamics. And those civil society organizations also working on gender, I'm not sure they've done so well in helping government to tease out the gender dynamics of some of those palliatives and those measures. In terms of gender-based violence, yes, we've seen FIDA, we've seen even the Nigerian police creating more desks across all police stations to be able to respond to gender-based violence. We've seen more help centers coming up where women or men facing violence can pick up the phone and call those centers. I think one problem that we're also saying is if they want to leave the house, because of the curfew or the lockdown, they can't leave the house. So they are stuck with their abusers for long. Plus also the fact that even if they leave the house and they've come to me as a non-profit to help them, I don't have a shelter to keep them. Plus, my resources also as that non-profit to help them has also dwindled. So these are some of the elements we also have to face. What is the gender dynamics of our various contexts in a pandemic? And how do we ensure that we are able to solve all of this? So in response to your question, quick one, we haven't seen that gender element teased out properly. Over to you, Omolara.
All right, thank you so much, ABC. I have another question here from Albert. Albert, I mean, any speaker could respond to this. He's asking to what extent has COVID impacted CSOs differently? I mean, CSOs within the large and the urban-based CSOs and then the community-based CSOs in your country. How have you seen these categories of CSOs respond to COVID issues, or how have they been impacted? The urban-based CSOs and then the local ones. I believe there should be some disparity there. So if you can share with us, maybe can I invite Beauty? In Ghana, how would you differentiate the impact of COVID on urban-based CSOs in the cities and then the local ones in the communities?
Thank you very much, Omona. In terms of Ghana, when you look at the urban-based CSOs, they have more resources and they have been able to they've been able to go through the shock of COVID by supporting their staff. So in terms of retaining of staff, the picture we see in the urban areas is that a number of CSOs have been able to maintain their staff. They have been able to pay salaries and all that. But the picture is not the same when you go to the local level. Most of the local level CSOs do not have sustainable resources. So a lot of them even depend on the national CSOs for existence. So with the shock, it has actually affected the resources they have and the kind of interventions they are able to engage in. So they have been adversely affected. And then when we talk about the issue of virtual engagements, most of them do not have the capacity to be able to hold virtual meetings as the urban established are able to. So this is also an area of challenge for them in terms of the capacity for technology, the resources. And that's why I think that it's important for us to mitigate this by knowing that as national CSOs, our existence and then in terms of the work that we do will depend on the district level or the local level CSO. So we need to put in some safety nets and make them strong, because now I cannot go to some of the intervention areas, but they are already in the community and they are able to access information quickly that we in the urban areas, especially even during the lockdown, we couldn't even go anywhere, but they in their respective communities could do that. So we need that kind of support and sustenance to be stronger and better in our advocacy.
Thank you so much, Beauty. Thank you. I have Olayemi Olatunde from ECOWAS. Olayemi, please, you have the floor. 1 minute, please.
Okay. Thank you very, very much. I hope I can do this in 1 minute. I want to quickly, first of all, clarify a few things. Let me respond to what one of the speakers said in response to what Hajia Momodu said about ECOWAS. I think, first of all, it's not right to say you cannot access information about ECOWAS. All you need to do is go on the internet the same way you went for the African Union, type in ECOWAS, you will see the communique of the heads of states meeting that held virtually over COVID. You will find information about what WAHO is doing. You will find a plethora of other information about what ECOWAS is doing. So first of all, I think we should be put all the cards on the table and be fair to all the institutions concerned. That's number one. Number two, ECOWAS is a body made up of ECOWAS countries. So we do need to understand that ECOWAS, when you say, what is ECOWAS doing? What is ECOWAS doing? ECOWAS is not, I don't know how to put it down. We're not a donor agency to African countries or to West African countries. ECOWAS is the grouping of ECOWAS countries and ECOWAS societies working together to help each other. So I think the question is a little bit, let me just leave it at that. We should be thinking about how possibly will ECOWAS help to accentuate what we are doing what exactly are the areas of comparative or competitive advantage for ECOWAS with regards to doing a number of things. And there's a lot that's been done. Apart from that, currently, before the COVID pandemic started, when, for example, in January 2019, we were working on the child policy, we did that with WACPODIS. We've done a lot of what we've done, and we continue doing that with civil society.
All right.
So let's separate that. But that's going forward. I think for everybody, and this applies to whether you are civil society, you are a state actor, you are an intergovernmental organization, ECOWAS, AU, whatever. We're all human beings. I guess all of us on this call are West Africans. We need to begin to think carefully and systematically about why we were, or what happened before COVID in terms of our social organization, the architecture of our societies, economic and otherwise. We need to think about the current response, and then we need to start thinking about how we will get organized beyond the current response. And I'll end with this example. One of the speakers talked about the problem of CSOs showing their contribution to national GDP, for example. And that is one of the problems with looking at how social organization functions. If we look at it just in terms of contribution absolute to GDP, for example, like the private sector, we don't consider the role of CSOs, for example, in organizing, in helping services to reach needy communities. It's just like you say, you know, a white woman who works at home as a housewife has no contribution to her family. I'm just saying that we need to rethink these things fundamentally and not accept, for example, somebody saying, CSOs, you don't sell oil or groundnuts. And because of that, you're not contributing to GDP.
Thank you so much. I'll have to take the other question. Thank you for your intervention. I wish we have more time to address that, but especially the point you made on ECOWAS and how you have been able, how you have categorized or interpreted our questions to ECOWAS Commission as an institution, but I'm going to leave it for now because we're expecting to engage on the ECOWAS platform, which Ajia already talked about. But thank you for your intervention. Emmanuel has a question to all the speakers. It says that what has been the role or significance, the role and significance of philanthropic institution in the fight against COVID across the different countries? I think Oyebisi and Beauty did mention some of the contributions that not only institutions, but philanthropic as a whole, individual and of course institutions, faith-based institutions, what they have shared, how they have contributed to COVID response, mechanism across the countries. So I want to take the next question because of our time. I really want us to keep this 10 to 12 so that in the future we can continue from where we are stopping today. The next one says, I think from Matthew, is asking in terms of documentation, and this is directed to ABC. How as civil society in Nigeria, how are they documenting cases of human rights violations to avoid duplication? Oh, I guess this is coming to you as the executive director of Nigeria Network of NGO. What has been the situation? How are you documenting human rights violations to avoid duplications? Do you have one or two things to say on that in 1 minute, ABC?
So what we've done as Nigerian Network of NGOs is to track what governments are doing and what's happening in terms of violations, plus also monitoring what the Nigerian Human Rights Commission is doing. I did mention that in my presentation, that the Nigerian Human Rights Commission is tracking violence and responding to it in real time. Plus also, they've also opened up call centers where you can call to report violations. We've heard the IG coming out strongly to encourage its staffs, the police, to say, please ensure you enforce or respect the rights of people when you're managing the curfews and all of those things. So for us, we're also tracking all of this. We have the Civil Society Action Group on civic space that has also opened a telecenter, and so far they've addressed about 54 cases from their reports that I read. 54 cases of violence across the country. They've taken that up, and they're taking it up further to the point of going to the courts to ensure that the rights of these individuals that were violated are really captured. I mean, again, this conversation around ECOWAS is not something we all want to take with sentiments. Okay, so I just got on the ECOWAS website. I saw the communique. I saw the closure of the ECOWAS office. What else am I seeing?
It's
that's not what I need, you know?
Yeah.
So, but again, just to mention, again, our institutions must listen to us, and we must listen to our institutions. You know, we must listen to feedbacks. We are listening to feedback as civil society. We went to bed when COVID started. Now we are waking up. So they must be able to tell us what we're doing, and we need to do better. We also should be able to tell them, for example, what is the impact of COVID on West African countries, the economy. We have that for the entire African country, but do we have it? Can I see it on the ECOWAS website? These are some of the things that we need as information for us to be able to advocate also. Just not to flag that. I'm not bashing ECOWAS. I love ECOWAS, but just providing feedback.
All right. Thank you so much, Oyebisi. I'm not seeing any other hands, or maybe I'm not seeing well. It's getting to lunchtime.
Yes, do I have the floor?
Yes, who is speaking and from where? Which country are you speaking?
Matthew.
Okay, Matthew, from which country, please?
From Liberia.
Okay, please go on, Matthew. You have 1 minute.
Okay, thank you very much for the opportunity. Quickly, I just want to mention the issues around opportunities that what we can do around ECOWAS. My organization have been having conversation with WACSOF and the executive director, Dr. Clement, and we have been thinking that in June, probably July, there will be an ECOWAS parliamentarian sections, and I think they are preparing or trying to make some preparation to have a virtual meeting, and we think that is one of the entry point we can use as civil society to see how we can document some of the best practices, because looking back from Ebola, my country was also affected during the Ebola crisis. What are those best practices that have been documented, and how we can learn from those best practices? Because we see countries in the ECOWAS region, some of those countries that was affected by the Ebola crisis, we see government differentiating from best practices learned from Ebola, and the shrinking space given the civil society and the role that civil society play in the Ebola crisis. We are not seeing that support coming from government with Corona, with the COVID-19. So we need to see how we can analyze the best practices that we learn from Ebola and how we can bring it to bear in the COVID-19, so that we can all have a successful impact that we want to see. But if people want, if, for example, government feel that it is their thing, they want to hold it as a government thing, we will lose focus on this fight and definitely will not succeed, because community support, community mobilization, community involvement is very key into the fight of COVID-19.
Thank you.
Thank you very much.
Thank you so much, colleagues from Liberia. Thank you. We have approximately 13 minutes. I want to take one last hand or questions. Otherwise, I would like to give additional 2 minutes to the speakers, and maybe Antoinette, we have 3 minutes, because I really want to hear about our position or what she has to say with regards to ECOWAS. I know she's pretty much a regional person and expert in the work that she does. So if I'm not seeing any other end at the moment, I would like to invite Antoinette to speak for the next 3 minutes. You were going to address and the opportunities that are there for CSOs in Togo to engage, to collaborate with Togo government, your position on how we can collectively as a civil society in West Africa engage with ECOWAS, and then your last word. Antoinette, if you are there, you have the floor now. Antoinette. Okay, I think, this technology is something. Don't worry, we'll get better at it. So I'm going to invite Beauty. Beauty, your last word as we round up before I...
Okay,
Hello.
many times. Hi.
Okay.
Hello.
Yes, please go on, Beauty.
Okay. Many thanks for the opportunity. I would like to conclude by saying that the era of competition among CSOs is over. COVID taught us lessons that the only way we can make impact is to have a collective CSO survival approach. Because once we exist, we are stronger, and then we are able to harness resources and efforts. I will also want to reiterate the fact that we have no option than to rise to the occasion, and we owe it to our constituents, we owe it to our nation, and we owe it to Africa to do better and to think outside of the box in terms of our engagement and how we interact among each other. We need to build a lot of trust. We need to open up and build a lot of trust in terms of engaging with each other so that we can share lessons and not duplicate efforts, but we'll be able to enhance the efforts that we are doing and become stronger and a critical force where political actors will see the kind of energy and the drive we bring onto the table. Thank you very much.
Thank you so much, Beauty. Thank you. Oyebiti.
Yes, I mean, mine is to say that, yes, civil society must introspect and begin to look at what didn't it do properly. Where did we go to bed, when the pandemic started and we were sleeping for like 3, 4, 5 months or, 2 months until we all started waking up. Yes, we've provided palliatives, but like one of the colleagues said, we won't just keep our work or our analysis at the money was spent. We also want to look at the volunteer time that we bring into the sector. We also want to look at the services that are being delivered. There's a huge value chain within civil society, the activities we do, the mental health portion of our work, the altruistic, portion of our work. So we want to be able to put some elements to all of those bits. Now, having said that, we need to collaborate differently. Collaboration, again, has to do with who is leading, how our hair goes. All right. Then how are we listening and engaging with government? How are we providing critical feedback? Again, the example of what just happened here now is a big lesson. We've provided some level of feedback. Maybe it looked like we bashed ECOWAS. ECOWAS has also come back to tell us that they are doing this. Now, within that culture, we probably won't be able to sit at the same table and look at each other's face more professionally. So what lesson do we want to learn in how we all provide feedback to each other? What's the role of our policy briefs? What's the role of our letter writing? Before we now carry placards and say, okay, now we want to get to the streets and fight. Having said that, also is that trust deficit that we have for ourselves as government, as private sector, as civil society must stop. Then also the fact that when you see Omolara sitting with the president and sitting with the big Fortune 500 leaders, are you saying Omolara is sold out? Whereas Omolara is just opening space for civil society engagement. So some of these things sometimes make some of us fear, because when they see you sitting and calling the president, they say you've sold to the other side. So we need to manage our own diversities as civil society. And I've said it, intelligence and stupidity lies within civil society. How we manage it to get common sense for the purposes of achieving development for the common man is what makes sense. Over to you, Omolara.
All right, thank you so much. Thanks for those words. Antoinette is still having technological challenges, and she's trying to put a point here. So she's saying civil society needs to rethink the way they engage with government. We need to create room to engage with government at all costs. And because our ecosystem has changed, we also have to change our strategies. Those are the points she has noted down. With 7 more minutes, like I said, this is going to be a monthly conversation. We are hoping we can keep the 3rd Wednesday of every month. 3rd Wednesday of every month. In terms of the points we are taking away and that we'll continue to work on, all the colleagues that spoke, talked about an increase in trust deficits within our society. They need to pay attention more to social protections, especially for those people who are at the very edge of the society. And also, we need to do advocacy differently, and I completely agree with that. And Beauty talked about the need for us to strengthen our base as civil society. Social distancing or no social distancing, we need to have a way to connect with the people that we represent, with our constituency. And she also mentioned that there are some of our colleagues who are working within this local communities. Those of us at the city centers, find a way to reach out with these people working at the community so that they can continue their work whichever way and strengthen that social, level of the constituency. We need to coordinate our activities to avoid duplication. This is really important, especially in this time and age of no resources. The little that we have to work with it smartly. That was raised. And unanimously, we talked about the need to document civil society contribution to GDP. I wished I could see my executive director's face when this was mentioned, because I guess a couple of days ago, we're talking about the need for civil society to document our contributions to development and particularly to GDP of our countries and indeed West Africa. Maybe until then, government may not see in figures what our contributions are. So this is another, and WACC has been challenged, with this, to take up this, and also find a way to monitor and document civil society's contribution during this COVID period. Oyebisi specifically talk about not only documenting our contributions to GDPs, but our specific contribution to COVID response. So that's like 3 levels of documentation that we have to work on. Yes, indeed, our sustainability has been challenged as civil society. We can see it for ourselves. I mean, where you have almost 20% of our colleagues having to lock their offices and go home without no options. I think WACC as an organization have been leading the issue of civil society sustainability, and COVID situation has further reiterated the fact that this is an important conversation and an important intervention that we need to strengthen. Our sustainability has been further threatened by COVID. Beauty mentioned the need to find a way to strengthen our technology capacity. Not only the capacity, the tools, the infrastructures within our organizations. Like I've been saying on various platforms, we knew the future was going to be technological based, but we did not know the future was going to come so soon. Unfortunately, COVID brought the future quite sooner than we expected. So it's important that as civil society, we invest in our technological infrastructure, skills, and capacity. We continue to track different violence that is going on. And we also talked about philanthropic giving. Interestingly, this is another area that WACC has been, working on, teasing out conversations and ideas on how to strengthen or build, the word is build, our philanthropic sector. I think it's been further reiterated in this platform that this is something that we have to do. Honestly, I cannot thank you all enough for joining us. To our speakers, Beauty from Ghana, Antoinette from Togo, Oyebisi from Nigeria, thank you so much for making the time to join this conversation, for sharing with us the impact of COVID in Nigeria, Nigerian civil society, how government and civil society have been responding, the opportunity we should be looking at for post-pandemic recovery, whenever that begins. Thank you so much. Thank you. And we are hoping we'll be focusing on another 3 countries next month, 3rd Wednesday of the month, and on another theme also that connects all of us together as civil society. To my team, thank you so much. To all the participants, questions, ECOWAS interventions, and other contributors, thank you for joining us for this webinar, the premier one, and we hope to see you next month. We'll be sharing the report of this meeting and some actions that we had to take. We're going to be sharing, and we hope to follow it through. Thank you again. My name is Omolara Balogun, and I work with West Africa Civil Society Institute as the head of policy influence and advocacy. Thank you and have a good day. Thank you so much. Bye.
Thank you so much, Molara.
Thank you, Beauty.
Thank you, Molara.
Thank you, Oyebisi. Thank you so much. Antoinette, thank you so much. I understand how difficult technology could be, but thank you so much. Thanks a lot. Thanks.
So that means the meeting is 2 hours. Over. So how do I leave now? Do you know I don't know how to leave? No. I need to leave the meeting. Maybe I should just close it.
Yeah.